Supplemental nutrition may be indicated in surgical patients under specific clinical circumstances to optimize recovery and outcomes. These indications can be broadly categorized as preoperative, intraoperative, and postoperative. Below are the key indications. 1. Preoperative indications: malnutrition, body mass index, BMI, 18.5, unintentional weight loss, 10 to 15% over 6 months. Serum albumin, 3.0 grams per deciliter, not related to liver disease or acute stress. Inadequate oral intake, inability to meet nutritional requirements for 7 to 10 days before surgery. High-risk surgeries: esophageal, gastric, or pancreatic surgeries requiring preoperative nutritional optimization. Chronic conditions impacting nutrition: cancer, inflammatory bowel disease, or chronic obstructive pulmonary disease, COPD. 2. Intraoperative indications: prolonged fasting, anticipated extended fasting periods 5 to 7 days post-surgery, major surgeries with significant metabolic demands, cardiovascular or major abdominal surgeries, patients with pre-existing malnutrition or catabolic states, severe trauma or burns. Postoperative indications: impaired gastrointestinal function, prolonged ileus, bowel obstruction, or anastomotic leakage. Inadequate oral intake, inability to consume 50% of caloric needs for 5 to 7 days. Increased metabolic demands, post-surgical complications like sepsis, wound infections, or organ failure. Conditions requiring prolonged healing, open wounds, pressure ulcers, or complex surgical repairs. Critical illness, patients in the intensive care unit ICU with high metabolic requirements. Types of supplemental nutrition: 1. Enteral nutrition preferred, indicated when the gastrointestinal tract is functional, includes tube feeding via nasogastric, nasojejunal, or gastrostomy jejunostomy tubes. 2. Parenteral nutrition, PN, used when enteral feeding is contraindicated or insufficient. Examples: bowel ischemia, severe malabsorption, high output fistulae. Key considerations: early nutritional assessment within 24 to 48 hours of admission. Individualized nutrition plans based on metabolic needs, comorbidities, and surgical complexity. Regular monitoring and adjustment of nutritional support to minimize complications like refeeding syndrome.